Go.
Good morning, everybody. I'm Justin. I'm from Intuitive. Thank you guys for being here. This is one of those situations that we just sometimes need a refresher for because hopefully this is a very rare occurrence. But when it does happen, it's something that we do need to have at top of mind. And so this is just a little refresher to make sure that when those events do happen, that we feel really good about what those protocols are. So there are three main things that I want to be able to cover in this, three things to walk away with. So the first one is when to use the instrument release kit. The second one is how. And the third one is what to do afterward, how to follow up. So I mentioned the instrument release kit. That is this. It's called a kit because it has the instructions printed on it as well as the key itself. All of these are in all 5 robot rooms over here at the tower. Our lovely robotic coordinator Val has labeled them all for you. So they're here, instrument release kit in this drawer. They're all in sterile peel packs. And you may have seen before a slightly different version of this. It had an orange handle on it. And that was for our old Endo-Wrist staplers, which we don't use anymore. All the staplers are sure form. And there's actually a different way to manipulate those, which I'll talk about here in a moment. This has 2 sides because one of them is for the key itself. And all the instructions, again, if it's been a year or longer since you've had a demonstration like this, all the instructions are here. So you don't need to worry about remembering all the exact steps. It'll tell you what those exact steps are. The other side is for the vessel sealer. There's not a key for the vessel sealer. There's a slide on the vessel sealer itself. So with our Sureform staplers, there's a knob that you can turn, crank, and that'll open the jaws. With the vessel sealer, there's a slider, which again, those instructions are here as well. And then there's the key instructions for these instruments. So, and by the way, if you have any questions at any time, go ahead and stop me. I will ask you at the end if you have any questions about certain circumstances that you've been in, something happened with the robot, and you weren't sure how to proceed. That way, if you weren't the only one in the room this happened to, we can make sure that's clarified for you. So, with the instrument release kit, I have here what's called a force feedback instrument. We don't have these yet. They're on order. These are for DB5s only. But mostly I just wanted to be able to show you that this key will work on all XIs and all DB5s, all of the grasper instruments. So I wanted to show you that it does work on here as well. So the first thing is when to use this instrument, or this key release. When is only when the surgeon no longer has control of the instruments, whether there's been a system fault where everything turns amber and the surgeon can't control it, but also if the instrument is grasped onto tissue. If the instrument is just floating there in the body, you don't need the key. You can still remove the instrument safely. If the instrument is grasped onto tissue and the surgeon is no longer able to control it, we're assuming that means there's been a malfunction with the instrument. When the cables inside is broken or something like that, and the surgeon can't control that. So again, the only time to actually use the release is when it's grasped onto tissue. Okay? And that's important because once this key is used on this instrument is done. It cannot be used again because again, we're assuming that there's been some kind of a malfunction with it. So if the key is used on the instrument, it's removed. We'll talk about what to do at the end. So only when it's grasped on the tissue, okay? The how is, again, all the instructions are printed on here, so I'm going to read it off so that it becomes familiar to you when you do use it. If the surgeon no longer has control of the robot or the instruments, there's an emergency stop button. It's both on the console, it's red here, it's on the console and it's on the cart. So the surgeon can hit that emergency stop button and any non-sterile personnel can hit it on the back of the patient cart as well. That just locks all of the motors to make sure that nothing is going to move without someone doing something to it. There is a slot on the back, or a really small hole on the back here. It tells you which direction to turn it, because what it does is controls, here I'll show you there, it controls these discs right here, which will manually open this. Okay, so I've put together a lot of IKEA furniture, I'm sure you have as well, so I know that you always put the short end in and crank on it, right, to get a lot of torque. Not so with this. This can be done very, very delicately. You do not need to be aggressive with this. Once you insert the key into the long end here, and that's part of why they say don't use the short end, because it's going to make you feel like you really need to crank on it. You'll insert the key into here. It tells you to turn it counterclockwise. And if you watch, I'm only doing about a quarter turn or maybe less. And that's all you need. I mean, I turned it, I don't know, a few degrees. And again, since the only reason is to be able to release it from tissue, that's usually enough to be able to release it from tissue. What we don't want to happen, because it can lead to other issues, is for you to open it all the way. Sometimes on some instruments it opens 180 degrees because you need to be able to remove that instrument, right? And if you're removing it with the jaws fully open, you can do damage to the cannula or potentially pull the cannula out, or do more damage to the instrument. And so all we really need to do is this one small turn, maybe a quarter turn or less. And it's very, very easy to do. We don't need to crank on it, right? So I'm actually going to pass this around so that you guys can get a feel for it. You can look at the instructions there. And then noticing again, this is one of those force feedback instruments, so it looks a little bit different. But again, this will work on all graspers for all XIs and all DV5s. The instrument, the key is the same for all of those instruments, and the process is exactly the same, okay? So we talked about when to use it, when it's grasped onto tissue, right? And I'm harping on that too because, again, this is, once the key is used, that instrument is done. So if this is the first life of the instrument, then we're essentially just, wasting that instrument, right? How to use it? Insert it into the back with the long end, very short turn, maybe a quarter turn or less. Ideally, you're able to do this under direct visualization. So, unless there's a catastrophic power outage or something like that, which is kind of a different in-service, then you're doing this under a visualization so you can see that the tissue has been released, you can see that it's away from the tissue, and then it can be safely removed, right? The third thing is what to do afterward. So afterward, we don't want to just discard this instrument, right? Again, we're assuming that this is happening because there's been an issue with the instrument, some kind of a malfunction. Intuitive wants to know about that so that we can fix it, so that we can issue a recall if needed, so that we can send you an instrument that isn't broken and we can use it again later. So, once it's used, you don't have to pause the procedure or anything. You can remove that instrument, you can get another instrument, the same, put it back in, hit that resume button, and continue the procedure just the same.
And where's the resume button?
I'm sorry?
Where's the resume button?
It's on the surgeon console.
Okay.
We're assuming that the surgeon is going to have autonomy over that situation, and so on the touchpad here, there's going to be a resume use button.
Okay.
And he'll be able to, key.
Thank you.
On all of the towers here, we have a number for DV Stat. If you've never called DV Stat, that's essentially our customer service hotline. It'll give you options for if you're in the middle of a procedure or whatever has happened, and it'll get you to the right person. You want to call DV Stat and report it. The information they're going to ask for is both here on the tower, which is usually what the SK number is, and then any serial numbers or any information about the instrument itself, when it was used, why it was used, etc. So they're going to ask you that information. That can be done after the procedure, but it has to be done within, I believe it's 48 hours. Let's not wait 48 hours. Let's let them know immediately. And then we need to let SPD know that this is not to be discarded and it's not to be recirculated. This needs to be returned to Intuitive so that they can investigate and see what went wrong. Okay? Now, I've shown you here. I'm going to make my way over to the robot here so I can show you what it looks like when you're actually using it on the system. Can you hold this one? So, same kind of instrument. We're docked. The jaws are closed. We're assuming they're grasped onto tissue. Again, none of this has to be aggressive. This can be done really delicately. But in order to make sure that, hopefully we're not up against an artery or anything like that, but if that's the case, before we actually insert this in, again, we hit that emergency stop button, so all the motors are locked up. We don't want any unintentional movement. You're going to support this instrument carriage right here. You put the key in, long end first. And as we talked about, just a little, support here, a little turn, just enough to release that tissue, and then you can pull the instrument out safely. Okay? when it's in an emergency stop, which it's not right now, the carriage will still be stuck here. In fact, I think I can do that.
And yeah, where is that emergency stop button?
It's on the patient cart helm back here. So I just hit that emergency stop here. There's actually a resume use button on here as well. So I'm not I'm not able to push it in or pull it out, but you would turn the key, pull it out, the carriage would be stopped here. You hit the resume use button, carriage will return back to its original position. And then you can just swap it out for new. So 3 things: when to use it, how to use it, and what to do afterwards. What questions do you have? Are there any